The World Bank has given out $54 million in 6 countries in Europe and Central Asia hit hard by rising food prices. It was part of the bank's multi-million-dollar response to the crisis. $17 million went to health and social protection projects in Kyrgyzstan and Moldova, and the Community and Basic Health Project in Tajikistan. All 3 projects aim to improve basic nutrition. Health officials in the Kyrgyz Republic, Moldova and Tajikistan worried that the food crisis was taking the heaviest toll on the country's mothers and young children. Governments in the 3 countries used World Bank funding for 3 different approaches to the problem. In the Kyrgyz Republic, the money expanded a project that helps pregnant mothers get basic nutrients they need. Staples like bread, flour and rice as much as tripled in price in a year. So health officials handed out packages with key vitamins and nutrients for mothers and their young babies.
Dairy products have increased, and it is a problem not only for me, but for the whole nation. I, for example, have a little boy who needs dairy products every day.
Dr. Guldana Dushenbaeva's maternity clinic was one of the several receiving increased funding from the World Bank.
The nutrition problem is one of the major problems among women, and we do our best in order to provide them with enough nutrition so that they can carry their babies the full 9 months and deliver healthy children.
A key to healthy children is healthy mothers. In Kyrgyzstan, cash transfers to offset the rise in the cost of food reached 360,000 families. And in Moldova, nearly $5 million went to hundreds of social institutions. In Tajikistan, vitamin and food packages reached 50,000 pregnant women, and nearly 4 times that number were educated on caring for their new babies. The food packages and the cash transfers to families and orphanages, hospitals and the like were helping. Aida Satibaldev and her husband Urmat told social workers in this office that soaring prices meant they could no longer afford to feed their family.
It is really difficult for our family to cope with the rising prices, especially for our family, which has 4 children and no income other than agriculture.
Aida says she needed the cash to buy food, especially flour. And she's not alone. In Moldova, World Bank funds boosted food budgets in kindergartens and special education schools. In Tajikistan, health workers monitored the growth and development of school children so as to identify and treat underweight students.